Hi, my name is Video-Marlowe, and I am a student occupational therapist from the University of St. Augustine. Today we're going to be working on a medication management plan for the medications you've recently been prescribed for Parkinson's disease, carbidopa, levodopa, and salicyline. A few precautions before taking these: you should really talk to your doctor about if you're allergic to any of the medications. You should let them know of any of the other medications you're taking, especially high blood pressure medication, antidepressants, or antihistamines. There's a list of others that I will have printed out and give to you. You should also let them know if you have or have had liver or kidney disease, because that's how your medication is processed, and it could have a severe effect if you are suffering from those. Common side effects associated with these medications are dizziness, lightheadedness, loss of appetite, trouble falling or staying asleep, confusion, nausea, drowsiness, and weakness. There are a few severe side effects that I've printed out for you, and if you feel those at all, you really need to go see a doctor immediately, because they can have a really bad effect on your body. So now that we have all of those out of the way, we can start talking about ways to incorporate these medications into your everyday life. So you and your wife live together in your 2-bedroom home. I know that you like to make coffee first thing in the morning, and so you should take these medications with breakfast and lunch to help reduce that nausea that we talked about. And so first thing in the morning, you like to make your coffee, so I really suggest keeping them right by the coffee maker, so it's what you see right when you wake up and while your wife is making breakfast, as a little reminder to take it in the mornings. I also advise that you set alarm clocks on your phones for 8 o'clock in the morning and 12 noon, because that's about the time you said when you like to eat breakfast and lunch. And again, for lunch, keeping those medications in the same spot next to the coffee maker, where you'll see them when you're making a sandwich or something like that, will really help. They also make pill boxes that you can get from Walmart or Walgreens for very little cost. They have them that have 2 slots for each day of the week, so Sunday through Saturday. I really suggest that on Sunday evenings, you guys said that you like to have some downtime and hang out, really just relax. Before winding down for Sundays, I suggest that you guys come together and put each pill in the boxes, so you have 2 doses for Monday morning and Monday evening or afternoon and everything like that, so that the next morning you guys you'll have it for the whole week, and you'll know Sunday, whenever it's done, that's the day that you need to refill it. In order to remind yourself to actually refill your prescriptions, I really suggest setting a reminder in your calendar or writing it down. Personally, I do both because I need to have 2 different reminders to know what to do. So knowing that 60 days, because you do the 60 tablets 60 days after, you need to get that refill. Also, you guys use Walgreens Pharmacy, and it's really cool that they make an app that make your refills easily accessible, and when you go out of town or have an emergency and have to stay somewhere beside your house, you can access the local pharmacies for Walgreens and have your prescriptions refilled there, which I think is a really great addition to be able to use them. I know that you guys go out of town a lot to see your children and grandchildren that live from Texas to New York and everywhere in between, and anywhere you go, you will have access to your prescriptions if you run out for any reason. An emergency plan I like to have just ready to go, just in case, because we don't want anything bad to happen, but sometimes it does. And so I suggest that you guys make a plan list, because I know you guys said you like making lists and being able to check it off to make sure you've gotten everything done. So having that list and having packed the medications first on the list, where you can just check that one right off and move along, is a great way to do that in preparation for emergencies. The Walgreens app actually will help as well. Even if you forget to pack your medications, you can easily get it refilled wherever you have to go after a hurricane or any other emergency or disaster. So that's really nice to have that. An alternative way to remind yourself to take your medications is this app called Mango Health. It's a free app that you enter the medications you're taking and the times you want to be notified, and it'll notify you just like an alarm every day at the same time, and then it has a 10-minute snooze button that it'll remind you again in case you forgot or got busy and didn't get to it. The really cool thing about this app is that every time you take your medication on time, you get points, and the points add up and you can get put into raffles for gift cards from Starbucks or Target, or you can give a donation for the ASPCA and everything like that, which is a really good incentive for you to take your medication, especially starting new. Overall, I feel like this is the best plan for you because having it right there with your coffee maker in the mornings and having the reminders on your phone will definitely help you to start taking it every single day, because it is a new routine and changing part of everything like that. If you don't feel like this is working for you after you've tried it for a little while, you can come back and see me and we'll be able to create something that is more suitable for your routines and habits and hopefully get you back on track with taking that medication. If you have any questions or concerns, please feel free to let me know.